Probably the most significant advance in the last few years is the growing awareness of how sleep-disordered breathing, including sleep apnea, affects people's lives overall. It was for years understood by a small group of sleep physicians, but how to take care of those things is really growing it by leaps and bounds. And one of the things that's coming to the forefront is that sleep-disordered breathing is partly environmental, but also partly structural. And so orthodontists are the only specialty that can change the structure of the growing face.
Well, I think what has really changed is the recognition of the importance of sleep apnea. You know, it was about that time, probably in the mid-90s, where we recognized it has some significant cardiovascular complications and implications. It's not just a question of someone being sleepy and snoring all night long, but in fact it had some health consequences. I think the orthodontist has a couple of unique, positions to do that. First off, as we mentioned, these patients just aren't being identified, and the orthodontist has the opportunity to potentially identify these patients. Increasingly, we have to have options, for therapy. Not everyone can tolerate the use of positive airway pressure or CPAP. We're all interested in improving the health, of our patients. And the identification of sleep apnea and treating sleep apnea would certainly go a long way to doing that.
I think getting involved with obstructive sleep apnea is important for orthodontists because they're not just dentists. We're not just looking at a beautiful smile. We should be concerned with the patient's life. 85% of the population is undiagnosed with this, and it's a severe problem that we have in our society. And who else is better to evaluate the oral cavity than the orthodontist? By recognizing disease that could lead to hypertension, cardiovascular issues, stroke, falling asleep at the wheel, those are things that are the most important, people's overall health. So an orthodontist shouldn't just look for the beautiful smile. They should also be concerned in the well-being of their patients. They're doctors.
When we reach a deep phase of sleep, the muscles of our upper airway relax. And when that happens, gravity takes effect. And if you have a really big tongue relative to the size of your jaw, it can fall backwards and plug up your airway so that you're not moving any oxygen or any air. So the consequences of obstructive sleep apnea can be pretty dire. They have an increased risk of congestive heart failure, pulmonary hypertension, cardiac arrhythmias, and there's actually an 8-fold increased risk of automobile accidents in patients that have untreated obstructive sleep apnea. With more knowledge and more awareness of sleep-disordered breathing, it makes perfect sense for the ENT and the orthodontist to work together. It's an opportunity from both perspectives to tremendously improve patients' lives.
I have suffered probably a lot longer than I know with sleep apnea, but I didn't know how bad it was until my wife started staying up at night, poking me to make sure I started breathing again. We are singularly placed as orthodontists to change the anatomy in positive ways that will help improve and it's really not cure but treat and manage people's sleep apnea. Just the mental anguish you go through, and you're angry. I mean, you're really quite irritable most of the time because of it. And when it goes away, it's like a miracle. I have gotten more hugs and more just genuine, heartfelt thank yous from taking care of people with sleep apnea than anything else I've ever done in my life. These people they come and they give you a hug and they say, "You gave me my life back." I really truly believe that orthodontists can make a difference in the world. This is bigger than straight teeth. This is bigger than bites. This is healthcare, and we can have an incredibly powerful effect on it.